A 50-year-old man with hypertension comes to the physician for a routine follow-up evaluation. His blood pressure is 146 by 90. The physician wishes to prescribe lisinopril. The patient says that his blood pressure is high when he is anxious and requests alprazolam instead of lisinopril. Which of the following is the most appropriate initial response by the physician? Now, what should I again? Don't forget the question. Most appropriate initial response. Initial response. A. I would recommend fluoxetine because alprazolam can cause dependence. I mean, first of all, you're talking to him about his blood pressure, and you're talking about blood pressure medications, and then you're going and flying off onto fluoxetine and SSRI instead of alprazolam because alprazolam causes dependence. This does not make much of the sense because you're not targeting his blood pressure in any way. Your main thing is to control his blood pressure. So A option doesn't seem like it fits in any way. Again, I would recommend consultation with a psychiatrist. This is referral. This is something that you do not require a psychiatrist to basically convince a patient that he requires lisinopril instead of as alprazolam for his blood pressure. This is stupid, and this is why healthcare costs in the US keep on increasing because everyone recommends patients to specialists for conditions that they can treat themselves just because they don't want to put in the effort to actually talk to a patient and explain to a patient why some of the treatment options are not valid. C. Anxiety can cause temporary spikes in blood pressure, but it does not cause a long-term increase in blood pressure. All right. Now, see, this option is partially, it is medically correct. All right. It is medically, anxiety can cause temporary spikes in blood pressure, but does not cause. You're telling the patient that yes, his anxiety can cause an increase in blood pressure when he has anxiety, but otherwise it does not cause a long term. This is correct. It is correct. Anxiety does cause an increase in blood pressure, but you're not targeting his question is he wants alprazolam, so you have to convince him that alprazolam is not needed because alprazolam causes a rise in blood pressure when he has an anxiety attack, not when he's now sitting in the office talking to you. So you're not targeting his question. This is basically deflection, so you can't choose option C. Even though it's medically correct, you can't choose option C. Option D. What have you heard about the use of alprazolam to treat high blood pressure? Now, when I talked to you initially and I told you about questions that are open-ended, questions that explore the views and ideas and knowledge of the patient, this is what I mean by that. This question explores the knowledge of the the patient's knowledge basically of alprazolam as a medication. You want to know what he's heard about alprazolam for treating high blood pressure. And you'll get that by asking him about what he knows about alprazolam. So that's why option D is the best option so far. Let's look at option E. Lisinopril is more effective to treat hypertension. If you do not control your high blood pressure, you may develop a stroke. In this one, yes, lisinopril is it's not more effective. Lisinopril is used to treat hypertension. Alprazolam is not used to treat hypertension. So that's a little off. It's not medically completely correct. And the second part is absolutely correct. If you do not control your high blood pressure, you may develop a stroke. But think about it. When you're a doctor, do you want to scare your patients into treatment, or do you want to make them understand that what treatment you're giving them is genuinely the best treatment? By telling him by saying option by saying that if you do not control your high blood pressure, you may develop a stroke. You're basically going to scare the patient shitless into actually taking lisinopril. He's not going to be 100% convinced of it, but he's like, I don't want to die, so I'm going to just take this medicine and just hope that I don't die of a stroke because of high blood pressure. So you don't want to do that also. You don't want the patient to be scared of dying, and that's why they take treatment. You want to instill that confidence as a physician that you can treat him and that what treatment you are giving him is the best and why alprazolam is not the best. So for that, you need to understand why he thinks alprazolam is used to treat high blood pressure, and then convince him that no, alprazolam is not the best choice. I am your treating physician. Alprazolam does help you with anxiety. Then you talk about your anxiety. It keeps on going on and on into a long discussion with the patient. But that's why option D is the best option.
Thanks for watching. Please give a thumbs up and subscribe for more.